Apollo Bay is particularly interesting. Apollo Bay was, of the 25 sites, the one location where at the start of the work 2 weeks ago, there were no positive traces at all of coronavirus because we've had no confirmed cases to date in Apollo Bay. Then on the 1st of September, we picked up the first positive sign of some traces of coronavirus in the Apollo Bay water catchment, and we picked it up again a second time on the 5th of September. I'm really grateful to all the residents of Apollo Bay who've come forward over the last few days to get tested. We encouraged, as of Friday, Saturday, people to come forward if they had any remotest symptoms within the Apollo Bay community, and I'm pleased to say that people have come forward over the last few days to do just that. To date, we've had all the test results back apart from 9. 9 of the tests due yesterday. We'll have the results later on today. To date, all those tests have come back negative. But we continue to implore people to ask them if you are in the Apollo Bay area and you have any remote symptoms of coronavirus, please come forward to get tested. And it is all part of, it's yet another one of our ways, or one of our tools that we can use to ensure that we maintain a high level of testing across the Victorian community. And as the level of cases reduces, as the level of community transmission goes down, we need to be ever more vigilant for looking for those remaining cases that are out there and getting to them as quickly as we possibly can. So again, for people in the Otway area, if you have any remotest concerns, Otway Health, McLaughlin Street, there's a 7-day testing centre there, one of more than 200 testing centres across the state. I would encourage you, please, to go and get tested, and we'll continue to be there to support you to make sure we get to the bottom of this. And that we are also, of course, continuing our encouragement as the number of cases goes down for people to continue to focus on those locations where there are still potential exposures. Every day on the DHHS website, we now identify potential exposure sites based on the previous day's cases. You can go there. I would encourage Victorians, please, regularly check on that website, check on those potential exposure locations, because it's important that if you've been in those locations and we know there's been a positive case in that area, that if you have any symptoms, that you do get tested. I would also, again, encourage people that, as we've said all along, this is all about people who, at the very earliest signs of having any concerns about their health, of any early signs of this condition, please come forward and get tested. The network is there. The waiting times are very short. We are now getting almost 90% of the results back to people within the first day. I'd like to particularly appreciate the people of Altona North. We encourage people in Altona North to come forward over the last few days. Again, we've seen some disturbing cases in the Altona North area, some very good work with local community members, local community groups, and Hobsons Bay Council. And I'm pleased to say we're seeing a number of people in the community now coming forward to get tested. All of that, as the Premier has said, enables us to get on top of this and to get on top of the coronavirus at its very earliest stage. So I will now hand over to Nick Crosby from Melbourne Water. Nick's been leading the research stage of this study, understanding how we can best optimise this new tool in our armoury. I can explain the technology behind it and how we're going to roll it out from here on in. Nick.
Thank you, Jeroen. Thank you, Premier. Well, this is an approach which has been tried before and has been successful in the surveillance of polio all around the world and has enabled Australia to maintain a polio-free status. So, in fact, it's not a new approach. Its attraction is that you can screen a large number of people by taking a relatively small number of samples. So in our case, we are currently testing at about 25 locations, and that gives us somewhere around 70% of Victoria's population. As the Premier said, if you don't expect cases, but you find traces of the virus within your sample, then that can prompt health to follow up with further action. So we do think that this is an approach which can add real value cost effectively, and we've been very careful to make sure that it's extremely well validated and we can trust the results. And with that, I'm prepared to take questions around how the approach works and any other technical questions.
Once case numbers are much lower, I'm assuming in the Melbourne sewerage system it's so broad that if you find traces, you can't then try and localise that to particular suburbs?
That's a very good question. We are working on a Sentinel system, but it's at this point in conceptual phase. So it could be that we could have a rapid traceback, but that is still a research endeavour at this point. In a large, you're quite right, in a population of 5 million, we do have 2 large treatment plants. One covers about 2 million, one about 1.8 million. So if you get a detect, it will be very challenging to find an individual or a small cluster without an efficient traceback
Is there the potential to do testing further up the system, I guess, before it gets to the wastewater
Indeed,
plant?
there is, and it's all about how do you allocate your sampling most effectively. And that's something we work closely with the health department to ensure that we are sampling at the most optimal locations. But yes, it is possible to sample right up in the network.
So at the moment we're just doing the big wastewater plants in Melbourne?
Principally, we're at 25 locations. There are 14 regional treatment plants. In Melbourne, we have 9 network locations as well.
And where are they? At the treatment plants? Or?
I can provide you the list. Do you want me to actually read them out? They're within the network, in various locations within the network.
So
Yep.
from one of those 9 locations, you can pinpoint a few suburbs at least, can you?
That's right. Yeah.
How broad's the area connected to each of the 19? Like, is it 10 postcodes, 3 suburbs?
They're large areas, and the traceback challenge is quite substantial in a large population. Yep. At this point.
Most effective, it sounds like, in regional areas like Apollo Bay.
The jury's a bit out on that, but probably yes.
How kind of up to date is the testing on how active the cases are? Is it more like I read here that it might fall off your fingers or things like that? Is it more going to pick it up kind of after the worst of the cases has passed? Do you know what I mean?
So, I mean, it starts principally in the bathroom, right? Many people who are infected will excrete in their stool. It can also be washed off their hands, or if they're using facial tissues, they might discard those facial tissues in the toilet. Then there's a timing issue. If there's just one person in a catchment, then the sewage makes its way to the treatment plant, and then you have to sample at a certain time to be able to detect that. In small locations, then the transit time might be as low as 30 minutes. In locations like Melbourne, then it's between 8 and 12 hours. But we do mostly use auto-sampling, which assists us with the sampling, in that we are sampling over a 24-hour period once an hour, and then we composite that into one pooled sample.
How accurate is this testing from wastewater? There have been traces of coronavirus found in Apollo Bay, but no positive cases yet. Is it possible that these are false positives, for example?
I'm pleased to say that the method is very well validated. So from an analytical perspective, we are very confident that the result means that we've detected the virus fragment.
So there is someone in Apollo Bay or who has...
Someone has excreted coronavirus at some stage in the catchment of Apollo Bay. I'll defer to health on any significance of that result, but as I said, our method is very well validated, and it means that someone at some stage has excreted coronavirus into the catchment.